Thank you for coming today. My name is Leslie Edwards Davis. I'm the Director of Benefits for the Health and Welfare Trust Fund. And we also have today with us Virve Moore and Emily Wegner. I'm going to let each of them just introduce themselves.
Perfect. Thanks, Leslie. My name is Virve Moore. I am the account manager for UMass EyeMed Plan, and happy to be here this morning.
And my name's Emily Wegner, and I work in eye care services here on campus at UHS.
So just to start, this is a brief overview of your EyeMed Vision Plan that you have as either a grad employee or a postdoc. Both groups have the same benefits under the eye plan. To start with, you just want to make sure that you've applied for your benefits and you fill out the application online with us. We'll confirm your eligibility and send you a confirmation of enrollment. And then my suggestion is always to go onto the EyeMed site and register for an ID card. It's a digital ID. You can also order a hard copy ID if you would prefer one. But then you have your registration all set up on EyeMed's site so that you can see claims that come through. You can check your benefits, check when you last used a certain benefit. It just opens up a wealth of information to you. And then you'll need to pick a provider unless you already have a provider. There are lots of in-network providers to choose from. There's an on-campus provider, and Emily is here today, and she'll talk a little bit about that. There's off-campus providers, there's brick-and-mortar providers, online providers. So there's lots of places to choose from to use your plan. And then you'll want to schedule an appointment and make sure that you give your provider your plan information. So this is a little snapshot of what our benefits portal looks like. This is where you'll submit your application. You'll send yourself a secure link to the application using your UMass Net ID. Make sure that you pay attention to the first question on the application, which is, are you the only person in your household, or do you have a spouse, partner, or children? Because that question then opens up family benefit options later throughout the application. And then make sure to do the final step, which is to e-sign your form. That allows us to then check your eligibility. And then we'll be sending you this confirmation of coverage email. This email is really important to keep. It has all the relevant links that you'll need throughout the year to download an ID card, look at your plan benefits. So it's an important informational email that you can access later on to remember, oh yeah, that's where I find a provider, etc. This is a screenshot of what the member registration page on EyeMed site looks like. Virve, once someone sets up their registration, I sort of described what they might find there, but once they access the eyemed.com site, what will they have access to?
Oh, absolutely. They will have access to pretty much everything. So this is the access to the member web on their EyeMed benefits. It shows all the information that they possibly might need. It shows their benefit summary, their eligibility. If they go and use their benefits, they can see their EOBs. There's great information about how to find a provider. In-network providers are, you can find your in-network provider by just your zip code of your home address, or if you already have a provider that you are using, like the provider right there on campus, you can see them listed. You can see their hours. You can also make appointments to most in-network providers online through this site. And also, EyeMed also gives you lots of special offers. So there's a different tab on here that you can find special offers and who's running them. And these special offers are something that can be combined with your benefit. But literally, we recommend that you register online. Everything's there. It's like your one-stop shop about your EyeMed benefit. We also have a fantastic app, and Leslie mentioned that ID cards can be downloaded from the member web. You can also, if you download the app from the App Store on your phone, everything that you can do on the member web, you can pretty much do on your app as well. ID card will be there just with the shake of the phone. Anything else, I mean, it's fantastic. So I highly recommend not only registering on the member web, but also downloading the app so that you get these, you have the online tools and member tools that you are always in touch with your benefit and what your eligibility is and whatever you might need.
Yeah, I sometimes forget about the app. The app is also great, and they can find that on the Play Store or the
Yes.
What's the Apple version called? I'm not an Apple person. The Apple Store.
I think, the Apple, even the Apple Store or the Google Play. I think that's where you can find them, and it's super easy, free download. iPhones. I think you also it has like a face recognition. It's super easy to use, and it's very very highly recommended.
Yes, I also do as well. And one of the things Vierve was talking about is the find a eye doctor part of the website, which is super easy to use. You can search in our network anywhere in the country. Our network is the Select network, and then you put in your zip code and it will bring up a long list of providers to choose from. We do have a sample list on our website, which is just some local Amherst providers, but you're not limited to just those providers. There's also an online search engine here. If you're just looking to order something online, that is also an option. So what's covered? I'm going to just do the highlights of this, but basically your exam is covered at a $10 copay, and that's a reduction of what the typical eye exam would cost, depending on where you are. How much is it? Usually like between $40 and $60. Is that approximate?
You mean retail price for exam?
Yeah.
It varies on a provider. It sometimes can be, I would say average would be like $100.
Yeah, so you get the eye exam for a $10 copayment. And then frames, you get an allowance to spend toward the purchase of frames. This year, we've increased it by $10 to $185. So the first $185 of your frames is covered by the allowance, and then you can get 20% off the remaining balance above that. We chose $185 to really try to capture what most people, the maximum they were paying out of pocket to cover that, so that most people's glasses they won't have to pay out of pocket for. If you choose more expensive frames, you may have to contribute toward that, but for most people this will cover their glasses. And then there's a co-payment schedule for the lenses. So if you're just getting single vision plastic lenses, that's a $10 copay. You can see the other copays depending on what you're choosing. The far right-hand column is the out-of-network reimbursement. So you'll see if you don't go to an in-network provider, which is possible, you can see another provider that's out-of-network, but the benefit is not as robust. So you'll see in the right-hand column the reimbursements for going out-of-network.
And I think it's good to mention here, since we're talking about out of network, if you do choose to go out of network at the time of service, you would have to pay everything out of pocket. And then EyeMed does have an online process to where you would send the claim. There's an online claim form, and you would have to add your receipt, and then you would be reimbursed on those out of network levels for your glasses or contacts.
Yeah, that's a good point. So our website, hwtf.org, right on the front page has the link to the submitted out-of-network claim site. So you can access it right from there if you need to. Sometimes we get questions about folks who have gotten glasses in another country. while they were covered under our plan, and they are able to submit those generally for an out-of-network reimbursement. So that's typically why folks might use it out of network. Sometimes they have an eye doctor that they've been seeing for a long time that they want to keep seeing. That might be another reason. But in general, if you're starting a new relationship with a provider, it's good to just pick one that's in network, and there are many to choose from. So this is a list of the various co-payments for the lens options. Then contact lenses, you receive an allowance of $150 per year to spend on contact lenses, a 15% off on the balance above $150. You can access the frame and the contact benefit in the same 12-month period, which is pretty unique. And we should highlight that this plan, unlike our dental plan, works on a point of service basis. So it's 12 months from the last time you used the benefit. And that is something you can look up. If you register on EyeMed.com, you can see, oh, when did I last get glasses? Right. It was last October. So I'm due for frames again in October of the next year. This is a relatively new component of our eye plan. We have had it for a couple of years now. It's the diabetic eye care product. And we added it just as an extra benefit for folks because there is such a strong connection between diabetes and eye health. So there are some benefits here that you can review if they're applicable to you. There's some discounts that we always want to remind folks of. So there's the 40% off a complete pair of prescription eyeglasses after you've already used your regular benefit. So you can get essentially that second pair at 40% off. There's 20% off non-prescription sunglasses and 20% off remaining balance beyond what your plan covers. And then just to review a couple of things, you can use the benefit online. So if they're going to order contacts, they'll go to contactsdirect.com. And then if you want to order glasses online, you can go to glasses.com. Is that right? BRB? You're muted.
Sorry, I was on mute. My dog keeps bringing toys here that squeak, so I put myself on mute in between. So yes, so there's actually 5 online providers that are in network for EyeMed. You have lenscrafters.com. They have both glasses and contacts there. You have targetoptical.com. You have rayban.com. You have glasses.com, and then the contactsdirect.com that are available for you. We will be adding a 6th online provider, which is great new news here. I can share. So Oakley.com will be also in-network provider come this fall. It hasn't happened yet. I don't know exact date when that happens, but we will be adding to that online in-network provider list. So we are very excited about that. But yes, so
yeah, that's great.
Yeah.
So some folks are curious how it works when you go to, say, targetoptical.com. So their site will ask you for your EyeMed plan information, and it should be able to connect your benefits right within the session and apply them before your purchase happens. So it's not something that you'll have to get reimbursed for later. It will connect to your benefits right when you're purchasing.
That is true. Everything will show up in the shopping cart. Yes.
Yeah. So, and then just a reminder, you can use the plan nationwide. You can use it locally, but you can also put in your zip code wherever you are and bring up providers. You can use them out of the benefits out of network if you need to. And then a reminder again that you can do both glasses and contacts in the same 12 months. And then before I hand it off to Emily, just other reminders. This plan is free for you as a working grad employee or postdoc. It's also free for your family members, including partner and spouse and children. So, and domestic partners. So all of those folks can, as part of your household, add onto your plan for free without a premium. It can be used again on or off campus. And that point of service reminder, just because it's different than our dental plan, I really like to highlight it, that the benefit renews 12 months from the last time you used it. So now I just want to let Emily have a few minutes to tell us what to expect if you decide to go on campus to use your benefit at the UHS Eye Clinic.
Yeah, thanks, Leslie. So again, my name's Emily and I work up in eye care services at University Health Services here on campus. We're up on the second floor of health services. We're open Monday through Friday, 8 to 4:30. We close 12 to 1. So if you're interested in utilizing our service, you can call to make an appointment. You can also walk in for optical services now as well. And if you want to schedule an appointment, you can reach us at 577-3937. And we are a full service eye care. We have Dr. Abraham, who is our optician. We have our optometrist, sorry. We have 2 full-time opticians that sell glasses here. And then we also provide contact lenses. We do take international prescriptions for those who have had exams at home. We just need to have a printed copy with the doctor's signature. And for those international students in the United States, just to let you know that you do need a prescription for contact lenses here in the United States. So you can either bring one from home or you can have an exam here to get one. And we also see patients for emergency eye care as well, just for those students here on campus. So if you have an eye infection or an eye problem, an issue with your contacts, you can also be seen for that as well.
I can't say enough about how great the UHS Eye Clinic is. They know our benefits inside and out. They will make sure that you're maximizing your benefits. They'll make sure that they check and make sure that you're ready to get new frames, like that you haven't already used the benefit within the last 12 months. Not all providers are like sort of looking out for you that way, but they do look out for you. And lots of our members go there because of that, because they kind of can trust that they'll be taken care of and that their benefits will be applied correctly and everything. So check out UHS Eye Clinic. We love them, and we love that they're accessible and close to most folks since they're on campus. We do have a question, and I'm going to throw it out to either one of you who would like to answer it. But how are prescription sunglasses covered?
They are covered, and Emily can chime in. Your EyeMed benefit covers that. Just like a regular pair of prescription glasses, if you would like to use your benefits on a pair of prescription sun this year, that is absolutely possible. Also, a lot of people, let's say you need a new pair of glasses and you get your regular pair of glasses and you would still like to get a pair of sunglasses as well in your prescription, you can use that 40% off discount for that second pair.
Yeah, so I think the only thing I would add is really the benefit works the same. You're just paying the copay for the tinting on the sunglasses. So that's really the only difference.
15?
I believe
That's a $15
so.
copay. So basically, you would use your frame allowance for that year. You'd pay the $15 copay, and it would work exactly the same. And then that would take up your frame allowance for that year. And you could get another pair of glasses on top of that, like Virve said, with the discount, or you could wait till the next year and use your frames for a regular pair of glasses.
I was just going to add one other thing that I would add is if someone ever like breaks a pair of glasses or really is in a bind, we do have an on-campus lab here that we do have the ability to make lenses in-house if someone really has an emergency. So they should always just call or even just walk in if it's an emergent situation.
Mm-hmm.
That's great to know. Thank you. All right. Any other questions from folks attending? Or I'm going to also try to think of some frequently asked questions that we get again and again. Some folks will ask, how important is the ID card? Do I have to have it? You don't have to have it. The provider should be able to find you with your name and date of birth and our group number. If they have trouble finding you, you can always refer them to us directly, or we can send you your ID card. I've sent people many ID cards while they're standing at the provider's office. So we can always help out and make sure that they're able to see you in the system. We also get lots of questions from families about, does my partner who's on my plan need their own ID card? They shouldn't, but I have noticed in the last maybe 6 months, EyeMed is now creating ID cards that you can access on the website for dependents. That I don't remember that always being the case, but now if you would like the security of having the ID card in hand for your partner, spouse, or children, we can also generate those cards, or you can get them from the website. But you're the subscriber as the employee, and providers will also just be able to find all of your family members that way.
Mm-hmm. And then really quickly, let's say you are the subscriber and you have children under 18 years old, you will be able to see them on the website under your plan. But now, like your spouse or your partner who are older than 18, they wouldn't want to register themselves on the EyeMed website to be able to get their ID cards and all the other information. It's just that we follow very strict HIPAA regulations. So that is why, you won't be able to see someone who's over 18, who's under your plan.
Okay, I think that's probably everything. So if you have additional questions, you can always go to our site, hwtf.org. You can email us at uwdental@umass.edu. You can access the eyemed.com site. You can call Emily for an appointment over at UHS. Depending on what your question is, one of those places will be able to answer it. I can guarantee you. Thank you both so much for being with us this morning. I really appreciate it.
Thanks,
Thank
Leslie.
you.